Most men wait until something goes wrong down there. But what if I told you your sexual problems actually start years before the first symptom? These simple checkups can prevent erectile dysfunction, boost testosterone, and protect your prostate, but 90% of men never do them. Are you one of them? Hey everyone, Dr. Eva Danielle here, men's health expert. Welcome back to the channel. Today we're talking about something most men avoid, medical checkups. But here's the truth. The tests and screenings we're going to discuss today could literally save your sex life, and possibly your life, period. Before we dive in, hit that subscribe button. We're going to break down exactly which tests you need at which ages, why they matter for sexual function, how to prepare for them, and what the results mean. Only about 15% of you are subscribed, so let's change that. Here's what most men don't understand. Sexual dysfunction is often the first warning sign of serious health problems. Erectile dysfunction frequently appears 3 to 5 years before a heart attack. Low libido might indicate low testosterone or depression. Changes in sexual function can signal diabetes, hormonal imbalances, or vascular disease. The medical checkups we're discussing today don't just monitor your sexual health. They monitor the underlying systems that make sexual function possible. Let's get into it. The annual physical, your foundation. Let's start with the basics that every man should have annually regardless of age. Blood pressure. Why it matters for sexual health. High blood pressure damages blood vessels throughout your body, including the tiny vessels that control erections. It's one of the leading causes of erectile dysfunction. Normal is under 120 over 80 millimeters of mercury. Elevated is 120 to 129 over less than 80. High is 130 over 80 or higher. What to do? Get checked at least annually. If elevated, check more frequently. If high, work with your doctor on lifestyle changes and possibly medication. Body mass index and waist circumference. Why it matters. Excess body fat, especially around your midsection, converts testosterone to estrogen, creates inflammation, and damages blood vessels, all of which kill sexual function. Healthy BMI is 18.5 to 24.9. Waist circumference should be under 40 inches or 102 centimeters. What to do? Get measured at annual checkups. If elevated, focus on sustainable weight loss. Waist circumference is actually more important than BMI for health risk. Comprehensive metabolic panel. This checks kidney function, liver function, electrolytes, and blood sugar. Why it matters. Diabetes is one of the biggest causes of erectile dysfunction. Kidney and liver problems affect hormone metabolism and medication processing. Key markers for sexual health. Fasting glucose should be under 100 milligrams per deciliter. 100 to 125 is pre-diabetic. Over 126 is diabetic. What to do? Fast for 8 to 12 hours before this test. Get checked annually, especially if you're overweight or have family history of diabetes. Lipid panel. Why it matters. High cholesterol causes plaque buildup in arteries, restricting blood flow. Remember, the arteries in your penis are tiny. They get clogged first. Optimal levels. Total cholesterol under 200 milligrams per deciliter. LDL, the bad cholesterol, under 100 milligrams per deciliter. HDL, the good cholesterol, over 40 milligrams per deciliter and higher is better. Triglycerides, under 150 milligrams per deciliter. What to do? Get checked every 4 to 6 years if normal. Annually if elevated or you have risk factors. Fast for 9 to 12 hours before the test. Testosterone testing. Critical after age 30. This is one of the most important tests for sexual health. Yet many doctors don't include it in routine checkups. Total testosterone. Why it matters. Testosterone drives libido, supports erectile function, maintains muscle mass, regulates mood, and affects energy levels. Normal range is 300 to 1,000 nanograms per deciliter, though this varies by lab. Optimal for most men is 500 to 800 nanograms per deciliter. But here's critical information. The normal range is very broad. A 30-year-old with testosterone of 350 is technically normal, but is at the very bottom of the range and likely experiencing symptoms. Free testosterone. This measures testosterone that's not bound to proteins, the testosterone your body can actually use. Why it matters. Total testosterone can be normal while free testosterone is low, causing symptoms. Normal is 9 to 30 nanograms per deciliter, though this varies by lab. Sex hormone binding globulin. This protein binds testosterone, making it unavailable. High SHBG means less free testosterone, even if total is normal. When to test? Get a baseline at age 30. Every 2 to 3 years if normal. Annually if you have symptoms like low libido, erectile dysfunction, fatigue, loss of muscle mass, mood problems, or difficulty concentrating. How to test? Must be done in the morning, between 8 and 10 a.m. when testosterone is highest. Fast overnight if possible. Avoid heavy exercise the day before. If results are low, repeat the test to confirm. What to do if low? First, optimize lifestyle through sleep, exercise, weight loss, and stress management. Consider working with a doctor who specializes in men's health or endocrinology. Discuss whether testosterone replacement therapy is appropriate. Don't use sketchy testosterone boosters. Work with a qualified physician. Hemoglobin A1C, the diabetes predictor. While fasting glucose gives you a snapshot, hemoglobin A1C shows your average blood sugar over 3 months. Why it matters. Even slightly elevated blood sugar damages nerves and blood vessels. Diabetic neuropathy affects the nerves, controlling erections. Vascular damage reduces blood flow. Normal is under 5.7%. Pre-diabetic is 5.7% to 6.4%. Diabetic is 6.5% or higher. What to do? Get tested annually if you're overweight or have risk factors. If pre-diabetic, take it seriously. This is reversible with lifestyle changes. If diabetic, tight blood sugar control protects sexual function. Thyroid function tests. Your thyroid regulates metabolism, energy, and affects testosterone levels. TSH, or thyroid stimulating hormone. Why it matters. Both hypothyroidism, which is low thyroid, and hyperthyroidism, which is high thyroid, can cause erectile dysfunction and low libido. Symptoms of low thyroid include fatigue, weight gain, depression, cold intolerance, and low libido. Symptoms of high thyroid include anxiety, weight loss, rapid heartbeat, and erectile dysfunction. Normal TSH is 0.4 to 4.0 milli-international units per liter, but many experts prefer 0.5 to 2.5. What to do? Get tested if you have symptoms. If abnormal, your doctor may order additional thyroid tests like free T3, free T4, and thyroid antibodies. Thyroid disorders are treatable, and correcting them often improves sexual function. Vitamin D levels. Vitamin D is actually a hormone and is crucial for testosterone production. Why it matters. Deficiency is extremely common, affecting about 40% of men, and is associated with low testosterone, erectile dysfunction, and depression. Optimal is 30 to 50 nanograms per milliliter. Deficient is under 20 nanograms per milliliter. What to do? Get tested at least once to know your baseline. Most men need 2,000 to 4,000 IU of vitamin D, 3 daily through supplementation. Retest after 3 months of supplementation to ensure you've reached optimal levels. Prostate specific antigen, the controversial test. PSA is a protein produced by the prostate. Elevated levels can indicate prostate problems. Why it matters. Prostate cancer, prostate enlargement, which is BPH, and prostatitis all affect sexual function. Normal is under 4.0 nanograms per milliliter, though this varies by age. But individual baseline and trends matter more than single values. The controversy. PSA Tests detect many slow-growing cancers that might never cause problems. Treatment for prostate cancer can cause erectile dysfunction and incontinence. It's unclear if screening saves enough lives to justify potential harms. Recommendations: discuss with your doctor starting at age 50 for average risk. Age 45 if high risk, such as being African American or having family history. Age 40 if very high risk, like having multiple family members with prostate cancer. Make an informed decision based on your values and risk tolerance. Cardiovascular screening, beyond basic tests. For men over 40, especially with risk factors, additional cardiovascular tests may be appropriate. High sensitivity C-reactive protein measures inflammation, an independent risk factor for cardiovascular disease and erectile dysfunction. Low risk is under 1.0 milligrams per liter. Average risk is 1.0 to 3.0 milligrams per liter. High risk is over 3.0 milligrams per liter. Homocysteine. Elevated levels damage blood vessels and increase cardiovascular risk. Normal is under 15 micromoles per liter. Optimal is under 10 micromoles per liter. High homocysteine is often treatable with B vitamins like B6, B12, and folate. Lipoprotein A. This is an independent cardiovascular risk factor that doesn't respond well to diet or statins. If elevated, it indicates higher risk and may warrant more aggressive risk factor management. Advanced lipid panel looks at particle size and number, not just total cholesterol. Small, dense LDL particles are particularly damaging to blood vessels. When to get these: if you have erectile dysfunction with no obvious cause, if you have family history of early cardiovascular disease, if traditional risk factors like cholesterol and blood pressure are borderline, if you want comprehensive cardiovascular risk assessment. Mental health screening. Depression and anxiety are major causes of low libido and erectile dysfunction. Why it matters: depression directly suppresses libido. Anxiety activates the sympathetic nervous system, which inhibits erections. Both create a vicious cycle with sexual dysfunction. What to ask for: depression screening using the PHQ-9 questionnaire. Anxiety screening using the GAD-7 questionnaire. These are simple questionnaires that take 5 minutes and can identify issues worth addressing. What to do if positive: discuss treatment options like therapy, lifestyle changes, or medication. Know that many antidepressants cause sexual side effects, so discuss this with your doctor and choose medications with lower sexual side effect profiles. Treating mental health often dramatically improves sexual function. Sleep study, the often overlooked test. Sleep apnea affects 20 to 30% of men and is a major cause of low testosterone and erectile dysfunction. Symptoms include loud snoring, gasping or choking during sleep, daytime fatigue despite spending enough time in bed, morning headaches, difficulty concentrating, and your partner reporting that you stop breathing during sleep. Why it matters: sleep apnea causes repeated drops in oxygen levels, fragmented sleep, elevated stress hormones, and crushed testosterone production. 69% of men with sleep apnea have erectile dysfunction. What to do: if you have symptoms, ask your doctor about a sleep study. Home sleep studies are now available and covered by many insurance plans. Treatment through CPAP, oral appliance, weight loss, or positional therapy often dramatically improves testosterone and sexual function. Age-specific screening guidelines. Let me break this down by decade. Ages 20 to 29, annual blood pressure and BMI. Every 4 to 6 years, lipid panel. As needed, STI screening if sexually active. Ages 30 to 39, annual blood pressure, BMI, and fasting glucose. Every 4 to 6 years, lipid panel. Baseline testosterone, especially if you have symptoms. As needed, thyroid if you have symptoms. Ages 40 to 49, annual blood pressure, BMI, and fasting glucose or A1C. Every 3 to 4 years, lipid panel. Every 2 to 3 years, testosterone. Consider vitamin D and cardiovascular inflammation markers. Baseline PSA discussion with doctor. Ages 50 to 59. Annual blood pressure, BMI, glucose or A1C and lipid panel. Every 1 to 2 years. Testosterone. Discuss PSA screening. Consider colonoscopy at age 50 or 45 if high risk. As needed. Sleep study if you have symptoms. Ages 60 and up. Annual testing of all the above. Discuss individualized screening based on health status. Continued testosterone monitoring if on replacement. Regular prostate and cardiovascular monitoring. How to prepare for blood tests. To get accurate results, here's what you need to know. 4 fasting tests like lipids and glucose. Fast for 9 to 12 hours, the water is fine. Schedule for early morning. Take regular medications unless told otherwise. For testosterone, schedule between 8 and 10 a.m. since testosterone is highest in morning. Fast overnight if possible. Avoid heavy exercise the day before. Get adequate sleep the night before. If results are low, repeat test to confirm. For thyroid, no special preparation needed, but be consistent with timing if monitoring. General tips. Stay hydrated as it makes blood draw easier. Bring a list of all medications and supplements. Write down questions beforehand. Ask for a copy of all results. Understanding your results. Don't just accept that everything's normal. Ask for specific numbers. Normal ranges are broad. So where do you fall within them? Ask about trends. How do current results compare to previous years? Ask about borderline values. If something is technically normal, but at the edge of the range, discuss whether it warrants monitoring or lifestyle changes. Get copies of results. Keep your own records so you can track trends over time. What results mean for sexual health? Let me connect the dots on how these tests relate to sexual function. Erectile dysfunction often indicates vascular disease, so check lipids, blood pressure, glucose, and inflammation markers. It can also indicate hormonal issues, so check testosterone and thyroid. It might mean diabetes or prediabetes, so check A1C. Low libido often indicates low testosterone, depression or anxiety, thyroid dysfunction, sleep deprivation or sleep apnea, or chronic stress with elevated cortisol. Difficulty with arousal or orgasm may indicate nerve damage, so check glucose and A1C for diabetes. It could also be medication side effects or hormonal imbalances. Working with your doctor. Many primary care doctors don't prioritize sexual health. Here's how to advocate for yourself. Be direct. Say something like, I'm experiencing erectile dysfunction and I'd like to investigate possible underlying causes. Request specific tests. Say, I'd like to get my testosterone checked, including free testosterone and SHBG. Ask about specialists. If your doctor isn't helpful, ask for referral to urology or a men's health specialist. Don't accept dismissal. You're just getting older is not an acceptable response. Sexual function can and should be maintained throughout life. Bring a list. Write down symptoms, questions, and tests you want to discuss. When to seek immediate medical attention. Some symptoms warrant urgent evaluation. Sudden, complete inability to achieve erection is a possible vascular emergency. Erection lasting more than 4 hours is priapism, a medical emergency. Blood and semen persistently. Severe pain with ejaculation. Sudden loss of sensation or symptoms of heart attack like chest pain, shortness of breath, or arm pain all require immediate attention. Your action plan. This month, schedule your annual physical if overdue. Request comprehensive blood work, including the tests we discussed. Write down any sexual health symptoms you're experiencing. Prepare questions for your doctor. Ongoing, track results over time. Address abnormal findings with lifestyle changes and medical treatment as appropriate. Retest as recommended based on results. Don't ignore warning signs. Your annual checklist should include blood pressure, BMI and waist circumference, comprehensive metabolic panel, lipid panel, testosterone if you're 30 or older, and A1C or fasting glucose. Medical checkups aren't about finding problems. They're about maintaining health and catching issues early when they're most treatable. Sexual dysfunction is rarely just in your head and rarely just about aging. It's usually a sign that something in your body needs attention. The tests we discussed today monitor the systems that make sexual function possible: your cardiovascular system, your hormones, your metabolic health, your mental health. When these systems are optimized, sexual function typically follows. Don't wait until you have a major problem. Get baseline measurements now. Monitor trends. Address issues early. Your future self will thank you. If this video helped you understand what tests you need, hit that like button and share it with men who need this information. Subscribe to the channel. We provide evidence-based men's health information. Drop a comment. When was your last comprehensive checkup? I read every comment. My name is Dr. Eva Danielle, men's health expert. Thank you for watching, and I'll see you in the next video. Knowledge is power. Get tested. Know your numbers. Take action.